We have Sal with us today. Sal is 55 years old. He's been a patient since May of 2003 and has been on testosterone replacement since March of 2007. So we're very close to 2 years. So what was the problem that we looked into your testosterone situation?
I was very fatigued. I was starting to be very fatigued every day, and I was losing a lot of my sex drive.
Was this fatigue significant, serious?
Yeah, I was very tired, waking up every morning. I had to push myself to go to work. I was fatigued all day long. Also, the sex drive.
How bad was that?
I was going 3 months, sometimes close to 4 months, without having sex.
And you had no desire or little desire?
Very little desire.
Now, how long had both these things been going on?
For the last 10 years.
10 years?
Yeah.
And then we checked your testosterone level. It was low, and we started replacing you 22 months ago. And what happened?
I started having a little more energy, a lot more energy in the mornings. I would get up. Once I took a shower, I was perky. I was a lot more perky. And throughout the day, I had a lot more energy. And I was having more of a sex drive. I was getting a lot more horny.
How much more? A lot more?
Yeah, a lot more.
And your sexual activity went from once every 3 or 4 months to how often?
I was once a month, and if we had the time, it would be every week.
And if you had more privacy, it would be how often?
Twice a week, once a week.
That's how you feel now?
Yeah.
And a big increase in energy?
Yes, and my sex drive.
Okay, you didn't have any problem with anxiety or depression or anything like that, so there was nothing there to get better?
Right. I wasn't depressed or anxiety problems.
Okay. Now, there's another factor with Sal. In April of 2008, after being on testosterone replacement for a full year, he underwent a total hip replacement. And tell us about the recuperation and recovery from that surgery. What happened in the hospital?
On the second day, I had the drive to get out of the bed. The nurses and the doctor was surprised I was out of bed the second day already. And even I was 3 weeks, only 3 weeks in the hospital.
What happened with the beginning of therapy in the hospital?
When I went upstairs to the therapist, they were surprised that I was how much I was moving around already.
That was on what day after surgery?
The therapy was a week later.
And they were surprised how much you were moving around?
Yeah.
Okay, and then you didn't go to any rehabilitation facility. You went directly home from the hospital?
Right. After 3 weeks in the hospital, I was home. Then I had to wait 2 weeks before they had a therapist come to the house.
And what was his reaction to your condition?
It was only 5 weeks after the surgery at that time, and they were surprised how much I was moving around. He was surprised. There was very little that he told me to do.
Because you recuperated so quickly?
Yeah. It was just only one exercise sideways. I had to move my leg more.
You know, that's a common story. When people have major surgery and they're on testosterone, they heal like they're 20, not like they're 50.
Yeah, I felt like 20.
Have you had any, you felt like you were 20?
Yeah.
Yeah. Have there been any side effects from the testosterone replacement?
No, I haven't had any side effects.
And is it working well now as it did when you started?
Yeah, I'm on the same dosage.
And everything is good?
I feel more energetic and more horny all the time.
Okay, well, I'm glad about that. Thanks for making the video.
All right.
I appreciate it.
You're welcome.